Hi, this is Dr. Miller. I am with Lisa right now. Lisa is, believe it or not, 9 days, just 9 days after a neck lift and a facelift. And I noticed that you are wearing a little bit of a turtleneck, but you don't even really have to.
I mean, really don't. You know, there's a little bit of incision under here. If you looked under my neck, you could really see it. But the swelling is just about gone. It does feel a little tight, but as far as the bruising, that's really almost non-existent at this point. So I've been extremely fortunate with how quickly I've recovered from this. It really was very, very quick, very, very fast. So I could not have asked for a better experience, honestly. And, you know, it's a little numb, but a little swollen, but boom, for 9 days out, it feels very good.
Yeah, you're healing wonderfully for 9 days. Tell us, what was it like for the first 24 hours? First of all, how did you feel going into it? What were your thoughts, or maybe sort of something you had to deal with before you even came to the surgery?
Well, you know, it's nerve-wracking. It's surgery, and somebody's going to cut your face. And as much confidence as you have in your team and your doctor and the people, you know, I personally had some friends and relatives that had done some work with you, and they were just ecstatic with the result. But because of what it is, it's stress-inducing. I can't say it any more clearly. But once you commit, you know, the things that were bothering me were not going away. It's the softness under the neck and the gels that were forming. And it's normal, but, you know, there was a way for me to take care of it. And so once you make that decision that you're going to go ahead with this, you have to have confidence in your team. And they, you know, the Miller office, Gotham Plastic Surgery, was just fantastic. I mean, the support was just overwhelming. So you guys made it so easy and as comfortable as possible, but
thank you.
You know, you can't if you're not nervous going in when somebody's going to put you under general anesthesia and take a scalpel to your face.
Right.
I really think that.
What was it like the first 24 hours?
The first 24 hours were rough because you're very bandaged. You know, bandage all around your head, very swollen, and there's achiness and discomfort, and but not unexpected.
Exactly.
So I was uncomfortable, but I wasn't frightened.
And we try to sort of give you, and that's one of the reasons why we're doing the video, is to encourage you to understand what you're going to go through. And I always say the first 24 hours, it's not fun. But then you'll come back, we'll take the bandage off, put a lighter bandage on for around another 2 days, another 48 hours or so. And then you can take that bandage off. Right. And how was it after that?
After that, you know, once you get that big bandage off, you feel so much better. It's really like this big cartoon bandage. But after that, you're giving like a elastic neck. It goes under your chin and around the top of your head. And I think it really is enormously helpful in terms of the swelling to wear that as much as possible. And once you're comfortable, I think, walking around, you go out, take a walk, you know, put your turtleneck up. But it really helps to have that neck bandage, I think.
Excellent. Yeah, and you're healing beautifully. You can't even see. The incision lines are right here in front and behind. Her hairline looks absolutely perfect. Same over here. There's just a little bit of bruising in the front and the back. And I'm absolutely thrilled. I really am.
Thank you.
Okay?
Thanks
really,
to everyone and this wonderful team.
Thank you.
It was the best I could have hoped for. I appreciate it.
Thank you.